Right now, we continue to follow the latest on the pandemic and the vaccine rollout. Tonight, the Department of Health is reporting more than 2,200 new cases of COVID, primarily among the unvaccinated. There's also been 26 new deaths.
Hospitalizations are on the rise. More than 1 out of every 4 hospital beds in the state are now being occupied by COVID-19 patients. Meanwhile, the Department of Health says Arizona has reached 50% fully vaccinated, but that's still below the national average. Hospitals in Arizona are continuing to care for those sickest with COVID-19 as cases continue to be driven by the highly contagious Delta variant.
As Team 12's Colleen Sikora shows us, staffing continues to be one of the biggest challenges for Arizona hospitals.
What's happening now?
We are all feeling the effects of the surge that we've been talking about.
More than 2,000 COVID patients are in Arizona hospitals, about a quarter of them in the ICU.
The vast majority of these individuals have remained unvaccinated.
In Valleywise Health, 38 patients have COVID while 14 are in the ICU. Dr. Michael White, Chief Clinical Officer, says 97% of them have not gotten the COVID vaccine. But in caring for these patients,
We continue to have, staffing challenges every day.
they're short 10 to 15 nurses a day.
Across the organization, across that, we have over, 400 positions open, from this. Within that bedside nursing, it's about 150, bedside nursing positions that are open.
Last week, Governor Doug Ducey's office announced money to bring in staffing for hospitals that are both offering monoclonal antibodies and offering COVID vaccines upon discharge. Monoclonal antibodies are a treatment for certain high-risk COVID patients and can only be administered in a narrow window. Valleywise is offering both and waiting to find out how many staff they'll get.
We're excited that the program exists. We're going to be able to utilize that and help us augment our staff as we have to get us, through this and through the surge of patients that we're seeing.
At Banner Health, they're offering the antibody treatment but not vaccines on discharge. Dr. Marjorie Bessel, Chief Clinical Officer, says they're needing staff still too and are bringing in contracted staff to help.
Banner Health continues to have many openings for nursing positions as well as other important positions such as respiratory therapists.
It's what's coming.
We expect to be very busy and more busy than we are currently.
Colleen Sikora, 12 News.
Colleen, thanks.